Hi everyone, Allison Meisler here, presenting my case presentation. I am going to present a case that I had a couple years ago when I volunteered for Northern Virginia Mental Health Institute in Fairfax, Virginia. While I was there, I followed a social worker and participated in groups, and also got to sit in on a couple other meetings with other professionals in the hospital. So I did not have access to any particular clients that the social worker I followed had, but I did get to get a little bit of information from patients themselves, and was there a couple times when patients came in and was given a little bit of information, but I did not have access to charts or information along those lines. But one case that I was present for was a case involving a 34-year-old woman who was separated from her husband, had 2 children, and was diagnosed with bipolar disorder too. She was brought in to the hospital because she was diagnosed with bipolar disorder and had stopped taking her medication, and was found on the highway in a manic stage, and was displaying very erratic behavior, and the police actually picked her up and brought her to emergency services, where they decided to send her to the institute with a 48-hour temporary detention order. So she had been to another hospital 2 times prior to coming to the institute, and she was on antipsychotic medications, and the hospital uses Abilify and Zyprexa, and that's just a side note. So I'm not sure what medication she was on, and she was also on mood stabilizers, and it was likely that the hospital put her back on, if she was not already on, Depakote, which is what they use as well. She did actually stop using the antipsychotic medication after 2 weeks when she left the hospital. So some important roles that I noticed that the social worker definitely plays in a real life setting is that they provide tons of support. They're always available to talk to, even if they're just walking down the hall, and they are involved in treatment management, and they sit in on tons of different meetings and that involve patients and involve other professionals, and they run groups, and they provide individual therapy. They are liaisons for outside services, and they provide a lot of discharge support up until discharge. So my role as a volunteer was really to be the fly on the wall and to listen and provide very basic provide very basic feedback to anyone that I interacted with, any of the clients. So but I did get to see what kind of services a social worker provides in the hospital itself. In application to the class, I witnessed adherence to medication and not adhering to medication. In this particular case that I'm talking about, there was adherence to medication once she was in the hospital, and she stayed on her medication and was participating in psychoeducation group and stress management group and medication education group, and stayed on her medication and was discharged in a relatively timely manner. A lot of talk about meaning of medication in our class, and I have been thinking a lot about this because I've never really thought about medication having a meaning, and I've shared this in a number of posts, but now that I think back on it, the patient actually did kind of disclose to me her feeling about medication. She stopped taking it because she, 1, felt like she was better, so she didn't need it, and 2, she also didn't like the symptoms that came along with being on the medication, being unmotivated and lethargic, and many issues that come up as being on medication. So I thought that in this particular hospital, there was great partnership practice going on with good listening and good advocacy going on with social workers, and sometimes they have to work a little harder to get patients to participate the way that they feel they need to in order to be active in their treatment, and provide them, and in order to help the social worker provide them with good services. But the social worker I worked with was very straightforward and would say things like, okay, so why'd you stop taking your medication? Kind of just putting it out there, trying to get it cut and dry, and not, try to be all candy coated about it all. Another really good thing that I think the hospital does, and I'm sure many other places do, is the medication education and the psychoeducation. I really enjoyed these topics in class, and I feel like they're a really important part of helping those with mental illness and who are on medication, because we're just developing medications all the time, and we don't really stop to think about what these might be doing to us, and being informed and being educated and about what you're putting in or what's going to go in your body is very important. My reflections on this experience that I had, I felt kind of discouraged by the fact that once a client is discharged, you might never see them again unless they return to the hospital for whatever reason it might be. And I feel like that could be hard for social workers because they might worry about what might happen to them. And I think that as a social worker for myself, or if I were to be a clinical social worker, that would be very difficult for me. And I do know that they do schedule an appointment 2 weeks later after a client is discharged, but after that, it's kind of up to a client to do what they need to do to help themselves. So issues that can come up are they stop seeking treatment, they stop taking their medications. This could be due to many issues such as feeling as though they don't need it, side effects, and money issues. Other than maybe exploring more meaning about medication, I do not believe I would have changed the experience that I had, or changed the aspects of the experience that I had, or had changed it as a social worker. Because I feel like a lot of the important topics that we've talked about in our class were hit on and discussed and displayed by the social worker I worked with.